be the left external jugular vein. Okay. Then this guy, the red one, okay, so the jugular vein is one of the veins that are just a vein, no artery associated with it. Okay, so if there's a dot on the red one, okay, that's going to be the artery. Okay, that's just an artery, no vein associated with it. Okay, so this is the right common carotid artery, left common carotid artery. Okay, and then you can see those from that heart model that I was showing you with the things. Okay, that's what one of those branches into, is the left and the right common carotid arteries. Okay, so if there's a dot on the red one, don't say external jugular artery, because there's no such thing, right? Because it's just a vein. Do we understand that?
Yep.
Okay. So external jugular veins, common carotid arteries. Okay. Then there's a vertebral artery. Okay, so it's going to be these weird doohickeys here. Okay. Most likely, they're probably going to test you on the skull. So if there's a dot just anywhere on the vertebrae, say vertebral. Okay. With this skull, you can if you see this model, there's only 3 things we can test you on. So if it's on the inside, it's the circle of Willis. Okay. If it's on the vertebral column, it's vertebral. Okay. These are your common carotids. Okay. So the point of the external jugular vein and the common carotid artery, those are the vessels that are going to supply blood to our brain. Okay. So if we remember way back, right, when we learned about the bones in the skull, okay, so remember we had those holes, the carotid canal and the jugular foramen, okay? Mm-hmm. Those are those holes that are allowing those vessels to come up to the brain and supply it with blood. Okay, so if that helps to think of, those are the guys that are going straight up and down too. Yeah. So again, with the skull, circle of Willis, okay, common carotid arteries, or vertebral arteries. Okay. Cool. So then we have the subclavians. Okay, so remember when we went over with the heart, it branches into those different things from the aorta, right? Okay. So the brachiocephalic's the part before it branches. Okay, it's going to branch into the right common carotid artery and the right subclavian artery from the aorta. Okay, this is the right subclavian vein. Okay, so again, remember sub meaning below, clavian, clavicle. Okay, okay. So right subclavian artery, right subclavian vein. Okay, vice versa. Left subclavian artery, the vein is cut off, but don't disregard it. It's there, but on this half they cut off the veins just so you can see it better. Okay, but don't disregard it. Know that it's there. Exactly. Yeah. So on that model, it has both. Okay, so we're looking that way, and then that would be the vertebral, and then the jugular and the carotids. Okay. Okay. And so then with a lot of these vessels, if you know either the bone or the region, you're going to know where the vessel is. Okay. So axillary, okay, if you remember the axillary region, that's your armpit, right? Okay, so that's going to be the vessels in our armpit. Okay. So this is kind of a debate between graduate TAs. I don't know what, like Whittian or Andrew or whoever you guys have. I know you guys have Vanessa. I don't know what they say, okay, but I always say that this is the axillary, okay, but some people might test it this way. So if it's just anywhere near your armpit, okay, just put axillary, because that's the only term you need to know around that area, okay? Mm-hmm. Honestly, it just depends on who puts the dot on it that day, really, okay? So you have the axillary artery, right side, okay? Axillary vein, okay? But if the dot's up here, okay, axillary artery, axillary vein, okay? So then on this guy, and that's where it gets kind of confusing, if we put it on this side, axillary artery, left, axillary artery, okay? Mm-hmm. So then we're going to go into our arm. Okay, so then you have your brachial region, right, which is our arm, okay? So you have your brachial artery, okay, so this is your left brachial artery, okay? Left brachial artery, okay? The vein, like I said, is cut off on this side. Don't disregard it, know that it's there, okay? Because it could be a word question or something, right? Okay, this would be the right brachial vein. It's cut off, okay? Because there's 3 different specific just veins in your arm, okay? So they cut this off so that way you don't get confused. Mm-hmm. Okay, but again, don't disregard it, note that it's there. But that would be the brachial vein. Okay. So with that being said, there's 3 different veins that are in your arm. You have your median cubital vein, your basilic vein, and your cephalic vein. Okay. So this guy that runs the innermost, okay, more medial, okay, the blue, that's going to be your left, right, basilic vein. Right, cephalic vein. Okay, so I always got those confused personally, so what I do is I use the aorta as a reference, okay? So I do A, B, C to help me remember. I don't know if that helps at all, but so if there's a dot on this middle one, okay, it's going to be the right basilic vein, right cephalic vein, okay? Okay, again, those are just veins. There's no arteries associated with it. Okay. So then we have the median cubital vein. Okay, so remember your antecubital region is the front of your elbow. Okay, it's going to be front of our elbow. You guys see the Y, the blue Y? Okay, and again, we're looking at blue because it's just a vein, right? That's your median cubital vein. Okay, so those are the 3 veins in your arm that are just veins, no arteries. Okay, so you have your basilic vein, your cephalic vein, and your median cubital vein. Okay, again, it's on the other side too. What's on one side of our body has to be on the other. For this model, it's not showing you. Okay. So then you have your radial and your ulnar. Okay, so remember radial is your thumb side and ulnar is your pinky. Okay, some people say PU, pinky, ulnar. Okay, if that helps. So if we're on the right side, or if we're on the thumb side, okay, it's going to be radial. Okay, vein, artery. Okay, if it's on the pinky side, ulnar. Okay, vein, artery. Right side. Okay. So that's the arm. Okay. So again, with the aorta, you have the ascending aorta, aortic arch. Okay. Then with the aorta, it's actually going to go behind the heart. Okay, so that's why you kind of don't see it for a minute and then it pops back up. Okay. That part that you can't see that's behind the heart, that's going to be your thoracic aorta. Okay, so remember our vertebrae, we had our cervical, thoracic, and lumbar. Okay. Thoracic meaning our rib cage. Okay, so thoracic aorta is going to be the aorta that's in our rib cage. Okay, behind the heart, thoracic. Okay, so then with that being said, abdominal aorta is going to be in our abdomen region. Okay, so if there's a dot on here, abdominal aorta. Okay, on the blue, okay, it's the inferior vena cava. Okay, because remember we enter through the heart through the inferior vena cava and the superior vena cava. Okay. Okay, so then now we're in our abdomen region. We have a superior mesenteric artery, inferior mesenteric artery. Okay, there's only one, so there's no left or right or anything like that. Okay.
Is there a vein?
We've never taught that there's a vein, but technically I'd say this is the superior mesenteric vein. Again, in the inferior, I can't see it. Maybe they'd probably put something down here, but honestly we've never tested on it. So, just because it's kind of hard to see where the artery is a lot more distinguished. Okay, so those are your mesenterics. Okay, so then we're going to talk about our renal arteries and veins. Okay, so remember we did urinary last week. Okay, so whenever you hear renal, you're going to think kidneys. Okay, pulmonary is lungs, cardiac's heart, renal is kidneys. Okay, so the renal artery and veins are the veins and arteries that supply our kidneys with blood. Makes sense, right? So these are your kidneys. Okay, so right renal vein, right renal artery, left renal vein, left renal artery. Okay, so far so good? Okay. So then, did we see that this, in between the pointer and my finger, do we see the wishbone?
Yes.
Okay. So these are your iliacs. Okay, when we're talking iliacs, we're talking our hips. So if you remember, again, with the bone, okay, remember our elephant ears? We had the ilium, the ischium on the bottom. Kind of remember a little bit? Going with the eye thing, okay? So these are our iliacs, okay? There's 3 different types of iliacs, okay? There's a common, internal, and external, okay? So, again, going with our wishbone, okay? So, between my finger and the pointer, okay? From here to here, and from here to here, okay? Those are your common, okay? So if it's on the red, okay, so it's going to be your left common iliac artery, left common iliac vein, right common iliac artery, right common iliac vein. Okay. How I remember that is that it shares the abdominal aorta or the inferior vena cava in common. If that helps. Okay. So up here, common. Okay. Then we go in. Okay. So these are gonna be our internal. Okay. Internal goes in. Okay. So again, opposite what you think. Okay. So this is your right internal iliac artery, right internal iliac vein. Hello.
Hi.
Okay. So then you have your left internal iliac artery, left internal iliac vein. Okay, so far so good?
Yep.
Anything after internal, okay, and to the end of the wishbone is going to be external. Okay, so the dot could be anywhere around here. Okay? So we have the right external iliac artery, the right external iliac vein. Left external iliac artery, left external iliac vein. Okay, so does that make sense? This is the most commonly mistaken thing. Okay, so common is what they share this guy in common. Internal is literally when they go in. Okay, external, you got to go in somewhere before you can go out, right? So anything after internal is external. Okay, So then we're in our leg. Okay, and again, if you know the bone or the region, okay, you're gonna know the vessel. Okay, so we have the femoral. Okay, so remember your femur, that big bone. Okay, and then it's also the femoral region. Okay, so femoral artery, the left one, left femoral artery. Okay, left or right femoral artery. Okay, the right femoral vein is gonna be this guy right here. Okay, because there's one specific vein that runs throughout your leg. Okay, and that's gonna be this long guy down here. It goes all the way down. Okay, and that's your great saphenous vein. That's in your leg. It's the only vein that's just a vein in your leg. Okay, so right, I always have to do that. Right, great saphenous vein. Okay, so which would make sense of why this would be the femoral vein, right? Does that make sense? Okay, so right femoral vein. Again, they kind of cut stuff off, so it's really confusing. Right femoral artery. Okay, left femoral artery. Again, there's no vein over here, but don't disregard it. Okay. So then we go to our knee. Okay, so remember the knee region is the popliteal region. Okay, so we have the popliteal arteries. Okay, right, then popliteal artery, left popliteal artery. Okay, this one doesn't show vein on either side. Again, don't disregard it. Know that there is one. Okay. Okay, so then we're gonna go down to our leg. Okay, so again, you remember our tibia, the bone, our thick inner bone, right? That's legit what our shin bone is. Okay. So we have an anterior tibial and a posterior tibial, okay? So remember, anterior means the front, posterior means back, okay? So if you think of like the post of an earring, it goes in the back, right? So if that helps, because that took me forever to be able to distinguish the difference, so if that helps, okay? So this is your tibia, right? Okay, so if it's in the front, okay, it's gonna be the anterior tibial artery, posterior tibial artery, okay? Anterior tibial artery, anterior tibial vein. Okay, the posterior tibial on this side isn't shown, but it is over here. Okay, so again, left or right, okay, anterior tibial or posterior tibial artery or vein. Okay, so that's the foot, sorry. Okay, so, or the leg. Now we're gonna go to the foot, okay? So you have the dorsalis pedis, okay? You can't see the vein on either one of these, okay, but it's the top of your foot. Okay, so this is gonna be your left dorsalis pedis artery, okay? Right dorsalis pedis artery. Okay, so this is still the top of the foot. Do we agree? Mm-hmm. Okay. Again, there's not a vein shown, but don't disregard it. Know that there is one. Okay. So then you have your arcuates. Okay, so arcuate is an arch. Okay, so do you guys see how this blue one is an arch? Red one's an arch. Mm-hmm. Okay. So this is going to be your right arcuate artery, right arcuate vein. You can't see the arcuates on this side. Okay. Mm-hmm. So we have the dorsalis pedis, which is the top of the foot. The arches are the arcuates. Okay. Then you have planters. So if you think you plant your feet, right? Okay, that's when you know you're going to be in the foot, right? And again, these orientations are going to keep coming back to haunt you. So you have your medial and your lateral, right? So medial is more towards your midline and lateral is farther away. Okay. So do you agree that the inside of the foot, this is more medial? Mm-hmm. Okay. Medial plantar vein, lateral plantar vein. You can't see the arteries. But again, don't disregard it. Okay? I think I got all of it.